Hello, welcome back to part 3 of the breast pathology and anatomy video. Today's video, we will be identifying different cases, breast clot positions, and breast quadrants. And I have several review questions and answers for you. Since I do have a lot of pathology that we are going over in this video, I want you all to read this disclaimer. This video is for educational purposes only. I am not a radiologist. I am a radiologic technologist that take mammogram images and send them to a computer workstation for the radiologist, which is the medical doctor, to interpret the images to make a diagnosis. I work in various departments in radiology, and one of my job titles are a mammography technologist, which is a mammographer or mammotech. In no way, shape, or form am I pretending to be a doctor. These images and questions are to help mammography technology students to pass their registry board exam. If you have any questions about your mammogram images or breast, please seek professional advice or reach out to your doctor. Thank you for understanding. I just want to throw that out because if someone come across this video and they have not been watching my Mammo Registry review playlist and other videos, I don't want them thinking that I am a doctor and I'm showing them what their images is or their diagnosis. So I just want to throw that out there. All right, I want to give a special shout out to these ladies. They passed their registry this month, which were in July 2025. So I'm sure a year or two later, when you all come back to this video, I have it like stamped up at the top that this is for July 2025. They used my videos. They just went through the playlist. If they was watching videos that they wanted more information about, they left a comment and asked me to make more videos of this topic or that topic or more practice questions and answers. So shout out to these ladies. I'm glad that they found my videos helpful. All right, so since we're still continuing the Mammography Registry review for procedures, I'll highlight it for you. Since we're working on procedures, there will be 65 questions. And in today's, we're going to talk about the pathology and anatomy. So that will give you 26 questions in this category or subcategory for procedures. All right, so now for the Q&A, if you are new to the video, I like to read the question, the answer choices, and I'll give you the answer. I just do this because it takes me a long time. I do this in my downtime. I'm not getting paid for it, so it takes me a long time to make these videos, and I do not want anyone reusing my content and claiming it as theirs. So that's why I just put my face in it and I just read. The questions and answers. If the audio bothers you, could you just please mute the video and you can just watch it like that? But we'll get on to the questions and answers. Okay, question 11 is question 11 because I already have another video with like question 1 to 10 about information about anatomy and procedures and pathology. So this is why I'm starting with question 11. So I try to remember to link that video at the end of this video. So question 11, a benign cyst is found at 4 o'clock breast clot position on the right breast. Which quadrant is this located in? Is it the upper outer quadrant, lower inner quadrant, upper inner quadrant, or lower outer quadrant? So I'll give you a few moments to think about the answer and then I'll give you the answer. So I already know these questions may require more thought, so I'll show you how you can get the answer. Okay, I'll give you the answer. The correct answer is the lower inner quadrant. So it's saying the benign cyst is found on the right breast in the lower inner quadrant. The benign cyst will be considered the lower outer quadrant if it was found at 4 o'clock breast clot position on the left breast. So if the benign cyst was found on the right breast, I know you all can't see me well, um, so this is my left breast. This is my left breast. This is my right breast. So if you're looking for a benign cyst on your right breast, you can do this if you have a question like this on your test, because I was at the test site dancing around trying to get the answer. So what you'll do is you'll take your right breast and you will feel and see which quadrant this falls in. So if this is 12 o'clock on your right breast, you can do it with me. So 12, 3, 4. So if you look at 4, it would be the lower inner quadrant. So you have to know your quadrants to get this right. So that's what you'll do. You'll just, whenever you come to these questions, you will take your hand, you'll go to whatever clock, and then you will determine if it's the upper outer quadrant, upper inner quadrant, lower outer quadrant, lower inner quadrant. Okay, question 12. A benign fibroadenoma is found at 2 o'clock breast clock position on the left breast. Which quadrant is this located in? Is it the upper outer quadrant, lower inner quadrant, upper inner quadrant, or lower outer quadrant? So if you do not know this just by thinking about it, I'll give you a few moments. Use your hands and feel your breast to see which quadrant it's located in. Okay, in a few more seconds, I'll give you the answer. Okay, the correct answer is upper outer quadrant. So like I was saying, you'll go to your left breast, and then it say 2 o'clock, so 12, and then 2 o'clock will be on this side, which is the axillary area, which is the outer quadrant. So the benign fibroadenoma is found on the left breast in the upper outer quadrant. The benign fibroadenoma would be considered the upper inner quadrant if it was found at 2 o'clock breast clock position on the right breast. So do it with me. Now we're going to go to the right breast to see why it's not considered quadrant, which is the correct answer. So we'll go to the right breast now. Find 2 o'clock. So it'll be 12 on your right breast. It's going to look different on my screen. But 12, and then you have 2 o'clock. So that would be the upper inner quadrant. It's inner because it's in the middle. It's inside. The axillary regions will be outer. So if you're all confused about this, just put in the comment box. I would suggest just re-watching the video, do what I told you to do, um, and then I also have some pictures that I can attach in here to kind of help you guide you, because this is just something that you will have to know. And this is the image that I was telling you about. So you can watch this picture and then go back and read the questions again until you understand it. So you can see right here, you have your right breast and then you have your left breast. And you see where 12, 3, 6, 9 o'clock is on the right and the left breast. It's different. On the right breast, 3 o'clock is in the inner side, but on the left breast, 3 o'clock is on the outer side. So you have to pay attention. And then this is the quadrants for y'all to look at. You have your upper inner quadrant, lower inner quadrant, upper outer quadrant, lower outer quadrant is different for each breast. All right, so if you made it this far, could you please leave a comment? Just let me know what state you're watching from or what country you're watching from. You can just leave a quick comment, say I'm watching from this is, and then your state or country. This is just something that I like to do, just to see how many states or countries are pushing out mammo techs who all are applying, which state or country have a lot of jobs available. It just helps other people, especially if someone want to leave their state or move to another state, they know which jobs could have more states which states could have more jobs available for them. So I have people watching from Houston, Georgia, Kentucky, California, Maryland, Florida, Arizona, and then I had someone new. Oh, I mentioned Kentucky. So yeah, just feel free to comment your state or country. Okay, back to the questions. Question 13. The pathology seen in this image is, so which pathology is the red arrow pointing to? Is it a breast cancer, macrocalcification, a cyst, or fibroadenoma? All right, I'm about to give you the correct answer. The correct answer is a cyst, and I have the reason for it. Give me 1 second. Going to give you the information for which um, breast pathology this is, which is a cyst, in the next slide, because this question will pretty much give away the answer if I show the information that I want y'all to see. But for question 14, which breast quadrant is this benign cyst located in? Is it the upper outer quadrant, lower inner quadrant, upper inner quadrant, or lower outer quadrant? Right. The correct answer is lower inner quadrant. And this is your CC image. Um, Let me point to you so you can know. This will be considered the outer quadrant, which is your lateral side. And then this will be considered your medial side, where you're trying to get like more of the medial tissue whenever you are positioning patient for the CC view. So that's how you know that's the lower inner quadrant. And then this is the information that I was telling you about like a couple of slides ago. If I would have just showed you all this information, it would have gave away that question I just asked you. But this information, this case is from the American Journal of Root Genealogy. So this is where I got this case study from. This is about cystic masses of the breast, and then you have your authors, and they're saying that this is a palpable left breast mass, and the mammography images did confirm that it was a circumscribed dense mass in the lower inner left breast. So this is where I got this information from. All right, so if you're finding my videos helpful, please like, share, and subscribe for more videos. Now back to the questions. Question 15. Which breast quadrant is this benign cyst located in? The upper outer quadrant, lower inner quadrant, upper inner quadrant, or lower outer quadrant? Just a few more seconds. It would be the lower inner quadrant. All right, so once again, all of these cases is coming from this journal that I told you about, and it's saying that this is a circumscribed dense mass in the lower inner left breast. All right, question 16. Which breast quadrant is this benign cyst located in? Upper outer quadrant, lower inner quadrant, upper inner quadrant, or lower outer quadrant? Right. The correct answer is upper outer quadrant. And this is just the reference where it's showing that this is a simple cyst. It's located in the upper outer quadrant of the left breast, and it is showing a circumscribed oval mass. All right, question 17. Which breast clock position is this benign cyst located in? Is it 2 o'clock or 4 o'clock, 12 o'clock or 6 o'clock, 11 o'clock or 7 o'clock, or 9 o'clock? And then just keep in mind this is your left breast, so you can feel your left breast and then feel the where the upper outer quadrant is at and just go from there. That's a hint. Okay, the correct answer is either 2 o'clock or 4 o'clock. And you can use this as a guide. I actually found this on the internet. I thought this was very helpful, especially whenever I was a new tech. And whenever someone is called back for a diagnostic mammogram, the radiologist report will say um, abnormality found at 3 o'clock, left breast, 7 centimeters from the nipple. So you'll have to look at the report if you're working on the diagnostic side. Let me know in the comment box if that's something that you all know how to do. Have you all been training on taking diagnostic mammogram images? Are you comfortable with doing it? Just let me know in the comment box. Question 18. Which breast clock position is this benign cyst located in? Is it 1 o'clock or 5 o'clock, 2 o'clock or 4 o'clock, 12 o'clock or 6 o'clock, or is it 9 o'clock? And then I'll just give you a hint. This is the right breast. Okay, the correct answer is 2 o'clock or 4 o'clock. So if you look down at the image, you can see on the right breast where 2 o'clock or 4 o'clock would be, it would actually be 10 o'clock or 8 o'clock on the left breast. So that's why you have to know which side you're looking at and your numbers and pretty much feel your breast to get these answers right. So the easiest way that I found this to be helpful for me, where the nipple is at, you already know that this is going to be either 12 o'clock or 6 o'clock. So this is the nipple right here. Right here is your nipple. So if you know for a fact where you're looking at, the nipple is 12 o'clock or 6 o'clock, whenever you get to the outer quadrant, once again, you have to be feeling your breast. What's on the outer quadrant? That's 9 o'clock. That's 10 through 11 o'clock. Uh, and then whenever you are looking in the inner corner, is 2 o'clock or 4 o'clock. So you have to know your breast and know the clock position. Question 19. A malignant tumor is found at 1 o'clock breast clock position on the right breast. Which quadrant is this located in? Upper outer quadrant, lower inner quadrant, upper inner quadrant, or lower outer quadrant? Okay, just a few more seconds. All right, the correct answer is upper inner quadrant. The malignant breast tumor is found on the right breast in the upper inner quadrant. The malignant tumor would be considered the upper outer quadrant if it was found at 1 o'clock breast clock position on the left breast. So that's whenever you have to feel your breast and see which clock position you're in. Look at the pictures that I gave you in the beginning of the video to help you determine and get these answers right. If you need to, you can study the picture, but try to answer these questions by feeling and touching and thinking before you run to the answer, if that makes sense. Okay, question 20. Which anatomy structure is the red arrow pointing to? So I know it's a lot of arrows pointing, so just look at the red one. Okay, the correct answer is the rib is pointing to a rib. Question 21. Which anatomy structure is the red arrow pointing to? Okay, the correct answer is the skin. Question 22. Which anatomy structure is the red arrow pointing to? It's pointing to the nipple. Question 23. Which anatomy structure is the red arrow pointing to? Right, the correct answer is the pectoralis muscle. Question 24. Which anatomy structure is the red arrow pointing to? Right, the correct answer is the ampulla. Question 25. A phyllodes tumor is found at 7 o'clock breast clock position on the left breast. Which quadrant is this located in? Upper outer quadrant, lower inner quadrant, upper inner quadrant, or lower outer quadrant? And I'll do this with you all before I give you the answer. I'll feel as well. So, 7. So I have my answer. Okay, the correct answer is the lower inner quadrant. The phyllodes breast tumor is found on the left breast in the lower inner quadrant. The phyllodes tumor would be considered the lower outer quadrant if it was found at 7 o'clock breast clock position on the right breast. So on the right breast, this is my right breast. So it's probably going to be confusing, but 12, 3, because this is the middle, 6, 7. So this is the outer quadrant, lower outer quadrant. On the left breast, 12, 3, 6, and 7, which would be the inner quadrant. So that's how you can determine that. If you're confused about that, just let me know in the comment box because I just want to know how many people is confused about it. But I would just say just keep looking at the pictures that I provided and just keep feeling your breast to know your quadrants and your clock position. But I still just want to know who all is confused about it. All right, so that's it. Thank you all for watching. Please give the video a thumbs up or leave a comment if you found this video to be helpful. Also hit the subscribe button for more videos so that you do not miss any videos. You can also check out my Mammography Registry review playlist, which if you click on my YouTube page, just click on playlist, just scroll until you see it. And another thing you can do is just look in my description box. I always put different information in there, as well as I also provide a link to click on to get to the videos quicker. But shout out to all of these ladies who passed their registry in 2025. So the ones that's above me passed their registry in May of 2025, and then the other one passed theirs in June of 2025. The ladies on the closest to the words on my screen, they passed theirs this month, which is July 2025. So thank you all for watching. Please feel free to share these videos with your friends or your classmates who you know is preparing for their registry exam as well. If you do not mind, after you have taken and passed your registry, could you please come back to one of the mammo videos and just share like these ladies did and say that you passed, and I will add you all to the shout out board. So once again, thank you all for watching, and I'll see you in the next video. Bye.